Hello. We are going over muscles of the neck, or at least some of them, and muscles that are used for breathing. So we're not going to go over all the muscles of the neck. There's a lot of them, and I think you'd be mad at me if we did go over all of them. What I do want you to know is that these muscles that are found in the neck region, they're often attached to the hyoid and or to the thyroid cartilage. And these muscles attached to the hyoid or thyroid cartilage, they're used to help you swallow or to move your tongue. So these muscles will attach to your muscular tongue, which would be in here, or for swallowing, like these ones shown here. So once again, I'm not going to teach the muscles for swallowing and for tongue movement, but you should know that they are attached to the the hyoid and or thyroid cartilage. Two muscles of the neck that you should know include this large muscle along the side of your neck, along the lateral portion. This muscle starts at the mastoid process of your temporal bone. It goes down, and I've moved this, but it attaches to your clavicle and to, what am I missing? Right, to the clavicle and to the sternum. Mastoid process, sternum and clavicle. So there are three attachment points. So it's called the sternocleido means clavicle, sternocleidomastoid. This muscle is the sternocleidomastoid. The sternocleidomastoid, this helps you flex your neck. It helps with flexion, it helps with lateral flexion, and it helps with rotation in the cervical Z-joints. Again, sternocleidomastoid is right along the side of your neck. Lateral flexion, regular flexion, and rotation. Going a bit more posterior, it's this very large, broad muscle. This is one half, or one of them, the one on the right side. This one really large muscle, this is the trapezius. It's kind of trapezoid shaped, I guess, especially when you have the other one. I would have said it's more kite shaped, but this is the trapezius, very large muscle, pretty superficial. What this muscle is for, while the sternocleidomastoid is for flexing the cervical region, the trapezius is for extending, so they're antagonists. The trapezius, you'll notice, also attaches to the scapula. This is the scapular spine. So the trapezius is also great for elevating your scapula, for shrugging. So if you do shrugs in the gym, you're working your trapezius. Those are muscles of the neck. Muscles for breathing also involve muscles of the neck and several other muscles. But the major muscle of breathing, the one that you use to breathe when you're doing quiet breathing, it's this long, flat muscle here. This is the diaphragm. We've seen the diaphragm before since it separates the thoracic and abdominal cavities. There we go. Very long, wide, thin, flat muscle. At rest, it's curved. So this is what the muscle looks like at rest. When this muscle contracts, it flattens out. And by flattening out, it's making the volume of the thoracic cavity bigger. If you know your physics, increased volume leads to decreased pressure. And pressure, like many other things, always travels from high to low, just like it's easier to go down a hill. So it'll be higher pressure in the atmosphere, lower pressure in the lungs, air will flow in. So when the diaphragm contracts, that's how you inhale. So if you ever hear the term belly breathing, that would be diaphragmatic breathing. So you can think about using diaphragm, but you don't have to. Your normal breathing is using your diaphragm. If you want to do more than just regular breathing, if you want to breathe harder, you'll need additional muscles. To breathe in, the muscles of inhalation, inspiration, you can use the sternocleidomastoids. Sternocleidomastoids can also be used for breathing. There's another muscle here called the scalenes. We're not going to discuss it, but this is another muscle used for breathing. It's a little off to the side here and a little deeper. But what I want you to know is sternocleidomastoid. There are rib muscles that are used for breathing in deeply. If you want to breathe in deeply, you have rib muscles in between the ribs. It's in between. The ones that are more superficial, those are the external intercostals. On this weird-looking model here, this is what we call the rack of ribs. So if this is the thoracic cavity, that means this is the internal intercostals. We're looking for the ones on the other side, the external intercostals. The external intercostals are for breathing in deeply. If you want to breathe out, if you want to exhale, if you exhale with normal quiet breathing, you just let your diaphragm relax. It just pushes the air out. But if you want to breathe out deeply, then you'd use those internal intercostals. So external intercostals are for breathing in. Internal intercostals are for exhaling. So it's kind of opposite in terms of the letters. You can also use your abdominal muscles, so your rectus abdominis and your three obliques. You can use your abdominal muscles to exhale. It's why if, let's say your friend tells you a joke and you can't stop laughing and your stomach hurts, you're overworking your abdominal muscles. Once again, to breathe in, besides contracting your diaphragm, to inhale, you want to contract deeply. To inhale deeply, you want to contract your sternocleidomastoid, external intercostals, and your diaphragm. To exhale heavily, you want to use your internal intercostals as well as your abdominal muscles. To inhale, sternocleidomastoids, external intercostals, diaphragm. To exhale, internal intercostals, abdominal muscles.